Good evening to one and all present here. This is Dr. Shivangi from the Department of Physiotherapy from Neurogen Brain and Spine Institute, Navi Mumbai. Today, first of all, a happy World Stroke Day to everyone present here. Today's topic that we are going to talk about is post-stroke recovery is a reality, a guide to achieving functional independence with a holistic approach. So the hashtag being hashtag don't let stroke decide your life. Stroke is defined as sudden neurological deficit attributed to an acute focal injury in the central nervous system, that is the brain. It is caused due to sudden interruption of the blood flow to the brain, leading to reduced oxygen and nutrient supply in that area. So, to analogize stroke, we can imagine a lawn full of grass. Okay, so when we are giving water to the lawn grows fully with grass. But as soon as the pipe that produces the water or provides the water to the lawn is blocked, there is ischemia. Ischemia means there is a sudden interruption in the blood flow or blockage of the pipe that happens, right? And similarly, when it is hemorrhagic, the pipe has a cut down. There is a blockage and the pipe tears down from between. There's a disruption of the blood flow there as well, and the water leaks out, and hence there is hemorrhage. Hemorrhage will also disrupt the blood flow to the area, and hence the grass where we are providing water in the lawn, it gets impaired. So, similarly is our brain. When the blood flow, the blood vessels carry is impaired due to ischemia or hemorrhage, there is a interruption in the blood flow. There will be reduced oxygen supply to the blood and the brain, and hence the nutrient supply in that given area is disrupted. Hence, ischemic stroke is decreased or absent circulating blood deprives neurons of necessary substrates, whereas hemorrhagic stroke is disruption of blood vessels and causes localized pressure injury. So, what will this cause? These strokes will cause mild motor deficit according to the extent of the injury in the brain, or gross involvement of various functions like sensory motor. There will be impairment in the sensation or the motor functions of the person. There will be perceptual deficits, whereas the perception of the person is affected. There will be emotional problems depending upon the area affected for the emotions, behavioral changes, memory, intelligence, speech, and language function may also be impaired. And all of these deficits, be it mild motor or gross motor, it will affect the activities of daily living according to where the area of brain is not getting the blood supply or the oxygen properly. So, coming to the theme for World Stroke Day. World Stroke Day is celebrated worldwide on 29th October every year. The theme for this year is hashtag precious time. Yes, stroke is a time dependent disease or illness. For the stroke to have lesser disability and higher survival rates, early and quick medical or surgical management by recognizing the underlying cause, basically ischemia or hemorrhagic, as we had discussed, is very, very important. Hence, the theme hashtag precious time. So, How do we recognize the symptoms of stroke? From the Beaumont College, it has now upgraded to FASTER. This is a mnemonic which shows us the early signs of stroke. First is F. F stands for face. So if there is any drooping or numbness on one side of the face, if a person is asked to smile and there is sudden drooping of the face, this can be a sign of stroke. Arms, when one arm drifts down than the other, when the person is asked to raise the arms, and or there is weakness or numbness in the arms noted by the person, it can be a sign of stroke. Stability, for S, that means if the person feels any dizziness, difficulty in keeping balance, walking, sudden incoordination, and the person falls down, it can be a sign of stroke. Talking means slurring of words while speaking, the inability to speak. The understanding is not the problem, the person is not able to speak. Hard time being understood while he is speaking. Suddenly, and so the person can simply be told to repeat a simple sentence like the sky is blue. And if he is not able to speak that properly or there is any slurring of the speech, that can be a sign of stroke. Coming to the E, that is for eyes. Difficulty in seeing one or both eyes, or there is a doubled vision suddenly, that can be a sign of stroke. And all of these signs, if noted, or some of the signs, if noted, you have to immediately react. That is, go to a nearby hospital, since we know that stroke is time dependent. Hence, call 911 or the emergency ambulance number around your house and visit the hospital as soon as possible. So, it will increase the survival rates and lessen the disability rates. Right? Hashtag precious time. Coming to the risk factors for stroke. Stroke project a lot of risk factors. One, high blood pressure. We all know there are a lot of people, approximately 8 out of 10 people have hypertension. They are on regular medications for the same, and hence high blood pressure is a risk for stroke. So please take your medications on time and avoid strokes. Coming to diabetes. Diabetes is again a systemic illness, whereas there is increased blood sugar levels. This will cause impairment of the blood vessels and in turn impairment of the blood flow. Hence, people with diabetes are prone to have strokes. So, take necessary measurements, keep your blood sugar levels at par, and you are far away from stroke. Coming to heart and blood vessel diseases like coronary artery diseases, anyone having a family history of heart diseases, of any vessel blockages in the heart, can also cause impairment in the blood flow to the brain and hence are at a risk factor for stroke. Smoking is also a huge risk factor for stroke. Brain aneurysm or arteriovenous malformations. Basically, brain aneurysms are abnormal dilatation of the blood vessels in the brain. Hence, when the blood vessels are forming a bulge abnormally, that may be congenital, or over a period of time that may just happen as a malformation in the blood vessel, such people are at a very high risk of developing a hemorrhagic stroke. Hence, regular checkups, regular doctor appointments are very necessary for avoiding stroke. Viral infections or conditions that cause inflammation, basically, these infections, as we know, COVID has also been a high viral disease, which might, there are researches showing that it might affect the brain, as in it decreases your immunity, right? And it may cause the neuronal death in the particular area being affected. Brain fever, if the fever rises up to a higher level, it may cross the blood brain barrier, and this can also risk for stroke. Age, so all the old age people are always at a risk of stroke since they have systemic illnesses like high blood pressure, diabetes, or any heart or blood vessel conditions. Hence, regular checkups for all the elderly are a necessity now. Sex. So, according to the gender, uh, there is a high risk for stroke for women post menopause. Basically, after the menopausal area, the estrogen effect decreases, and hence women are at a high risk of stroke. There is no defined thing, whereas we say that men are more susceptible or women, but yes, regular checkups for both are necessary, and postmenopausal women are necessary to take care of themselves. Race and ethnicity. Uh, in USA, strokes are very common in African American, American Alaskan, and Indian American races, and so it is also a risk factor for stroke. We need to prevent stroke from happening. Coming to family history and genetics, if there is a family history wherein a person from your close family or relatives have had a history of stroke or a blood vessel disease, there are high chances of a stroke that may follow in the family history, and hence you have to be cautious. Not scared, just cautious. Coming to other factors which can be controlled for stroke, that is anxiety, depression, and high levels of stress are detrimental to our physical and mental health both, and hence project a risk factor for stroke. Living or working in areas with air pollution, other medical conditions like sleep apnea, that is disturbances in the sleep, kidney diseases, migraine, that is the headaches that we have, the migraine headaches, that are also a risk factors for stroke. So get treated for your migraines. Sickle cell anemia, bleeding disorders like thalassemia are all a risk factors for stroke. Other unhealthy lifestyle habits like improper sleeping habits, drug consumption, alcohol consumption, all of these are also a risk factor for stroke. Coming to the last, not the least risk factor for stroke is the overweight and obesity. This leads to high cholesterol and high lipid levels in the body, and hence can project a problem for the blood vessels, and again in turn resulting in interruption in the blood flow and a higher risk for stroke. Coming to the management of stroke, how can we manage stroke? Acute medical management is based on the type of stroke where it has happened. Basically, ischemic stroke, that is the decreased blood flow or the interruption of the blood flow, can be managed by medications, or the clot that has been formed in the blood vessel, it can be disregarded, as in the clot formation has to be uh, broken down to restore the normal blood flow, right? So this can be the acute medical management for stroke in ischemic stroke. For hemorrhagic stroke management, it is focused more on the underlying cause of the bleed, as in which vessel has disrupted blood flow, which vessel has broken down or is leaking the blood from a particular region. That can also be treated by reduction in the blood pressure. If there is sudden increase in the blood pressure, the pressure on the blood vessels to make the blood flow, there can be hemorrhage. So first, reduce the blood pressure or the treatment of the dilatation of the vessel, that is the aneurysm. So if we coil the flow, we prevent the blood vessel from rupturing, it can be managed. Medical and surgical strategies aim at prevention of the recurrence of the stroke, right? The window period. Now, what is the window period for treatment of stroke? From the beginning of the symptoms, noting faster, to imaging, to confirming the causative factor of the stroke, up to what can be the treatment, as in drug administration or the surgical intervention, depending upon the region of the brain being affected and the extent and the area of brain being affected. Whereas, can we restore the blood flow from the neighboring blood vessels present in the brain? All of this is very crucial to decide the window period for the treatment. So, as per the researchers, 4.5 hours to 6 hours is the window period for treatment. In this window period, if we note the symptoms, we do the imaging, we confirm the diagnosis, and we administer the drug or the surgical intervention and restore the blood flow to the part of the brain being affected, yes, we are in the window period, and it will lead to lesser disability and higher survival rates. So, according to the American Stroke Association guidelines, on an average, 1.9 million brain cells die every minute that a stroke goes untreated. So, do you guys understand the severity of the blood flow interruption? For every minute, it causes 1.9 million brain cells to die. So, early treatment leads to higher survival rates and lower disability rates. If somehow the window period is missed or there are unmet medical needs, okay, so with the current treatment approaches that we have, be it medical, surgical, or the rehabilitation that we go through, the pathologic process or the damage that is done to the brain due to the decreased oxygen supply or the blood supply to the area of brain occurs at a very microcellular level, that is at the brain cell level, and it cannot be reversed. Hence, a treatment approach which acts at a more cellular level or at a neuronal level. Neurons are basically the cells of the brain. So, when a treatment occurs at the cellular level, the risk of the R to reduce the residual impairments, that is all the sensory motor, other emotional, perception, and leading to our activities of daily living that are impaired, all of these risks are reduced following a stroke. How can we reduce that? The question comes to that. Coming to the role of stem cell therapy. Hence, stem cell therapy offers the hope for stroke patients, especially those who have missed the window period, that is 4.95 to 6 hours. Yes, we here at Neurogen Brain and Spine Institute, Navi Mumbai, provide a holistic approach towards healing the residual impairments that is crucial for the stroke recovery. Now, how does the stem cell therapy work? Stem cells basically impersonate the natural process of recovery of stroke. Basically, it is the mobilization of the autologous stem cell. What is autologous stem cell? That is the cells that are present in one's own bone marrow. That is, if I am the one having stroke, I have my own bone marrow where there are cells that are present, right? We aspire the cells from our bone marrow and we mobilize it. We inject it to the area of brain which is being affected, right? So, it will naturally impersonate the process of recovery of stroke, and it will act at a more cellular level, which is necessary to reduce the risk of residual impairments. Hence, stem cell therapy aims to repair the damaged part of the brain, that is the area where the neurons are completely damaged. Whereas in acute stroke cases, which is uh, very recent, a stroke episode that is very recent, it aims to reduce the effect of the ongoing injury, right? Like decreasing the brain swelling, decreasing the effects of stroke, and hence reducing the impairments. So we here at Neurogen, we have treated over 121 patients of stroke, and statistics show that 90% patients with stroke show clinical improvements after the stem cell therapy. And here is a graph to show that. The other published data of Neurogen BSI, our results show that PET-CT scan, that is a functional scan of the brain. Basically, this is a scan which shows the areas of brain which are hypometabolized or low functioning and hypermetabolized, that is more functioning or normal functioning. So here you can clearly see in the image above, first image shows that before stem cell therapy, the blue area circle that represent reduced brain activity due to the damage that occurs due to the brain tissue that is being affected due to interruption of the blood flow, that is stroke. And post stem cell therapy, 6 to 5 months post stem cell therapy, there was improved metabolism in the frontal lobe, occipital lobe, and the basal ganglia on the left side, as indicated by the circles. Hence, post stem cell therapy transplantation, every patient now undergoes with an extensive rehabilitation with a holistic approach under one single roof. What do you mean by a holistic approach? The neurorehabilitation that happens after the cell therapy is done is tailor-made. That means it is designed according to the functional impairment each and every person faces post-stroke, be it grip weakness, be it lower limb weakness, be it speech problems, be it language issues, be it behavioral issues, be it balance issues, be it problems in walking, whatever it is tailor-made according to the needs and the functional impairments of the person who is suffering post-stroke. So what are integrative therapies that are available at Neurogen BSI? First is physiotherapy, coming to occupational therapy, aquatic therapy, walking track for gait training, speech therapy, psychological intervention, diet counseling, group therapy or motivational workshop, hyperbaric oxygen therapy, and ozone therapy. Now, I will explain about each and every therapy in detail, and I will give you an overview of what a holistic approach means to achieve the functional independence we want in our stroke survivors. So coming to neurorehabilitation with physiotherapy. Bed mobility independence training is one of the major things that we focus. We here at Neurogen, as a department of physiotherapy, aim to make the patient independent in the bed mobility, because post-stroke there is a lot of weakness in the upper limbs or in the lower limbs according to the symptoms, and hence we try to train them with different approaches, giving weight on the unaffected side, bearing weight on the unaffected side or the affected side. Hence, all these functional and compensatory approaches are important to achieve the functional independence. As we can see here, the side to side movement by clasping both the hands, this will help in the turning and the rolling movement in the bed. So, bed mobility is very important. Why is it important? If a patient is bedridden and he is not able to move due to the weakness or the functional impairments, the person is at a risk of a lot of other secondary complications, and we don't want that. Hence, to be functionally independent, bed mobility is the first thing. Coming to the suspension therapy exercises for weaker muscles. So, here at Neurogen, we have a suspension therapy unit where we provide exercises that are given in different planes or in different positions for the hand, the lower limbs, the arms, the trunk, everything. And hence, all of these movements will increase the strength of the upper limb, the lower limb, or the trunk, and hence it will target the weaker muscles that have gone into weakness post the stroke. And once the suspension therapy has begun, after a few weeks, after a few weeks of diligently, determinedly doing the exercise over and over again with a lot of repetitions. Okay, why repetitions? So, neurodevelopmental technique says that as a person repeats a particular movement, there is motor learning in the brain happening, right? So, all these suspension therapy exercises that we target for the weaker muscles eventually will increase the strength. There will be motor relearning of the movements that have gone weak due to the functional impairments, and then after a few weeks we can progress to the active and the resistance exercises that will in turn help in even more strengthening of the muscles so that the patient can do exercises with external weights or by hand resistance given by the therapist, and hence all of this will lead to improvement in the strength of the weaker muscles and we can get stronger muscles. Coming to other exercises that are important to promote weight bearing. So, post stroke recovery, we know that there is a particular area or a particular limb or particular limbs that go into weakness. When we tend to feel the weakness in particular limbs, we do not take weight on those part of our body, and hence to promote that weight bearing it is important to relearn everything. So from basic activities from sit to stand using a proprioceptive neuromuscular facilitation technique to pelvic bridging, which is important to weight bear on your hands and basically on bilateral, as in both the legs or one leg. It is important for the trunk muscles to be strengthened. Also, all fours position, that is the quadruped position, it also helps in uh, gaining trunk control, bearing weight on upper and lower limbs, and basically it provides proprioception to all the four limbs. Kneel walking exercises, that is walking on the knees. It improves hip knee flexion pattern and also helps. So, what is hip knee flexion pattern? When we are walking, if our hip, that is our hip joint and the knee joint, don't work in coordination, there will be impairment in our walking pattern. And hence, this is one of the preliminary exercises that helps in normalizing the function of the hip and knee flexion movement while walking. Coming to extensive gait training. So, when a patient has weakness in one of the hand and one of the legs, that is one-sided affection, we try to train the abnormal gait pattern or the abnormal walking pattern with the use of assistive devices like cane or walker according to the patient's security, the patient's functional extent of functional impairment, and extent of how weak are the muscles actually. So extensive gait training with a lot of repetitions and a lot of motor learning is very, very important for neurorehabilitation with physiotherapy. Mobilization, the movement, the confidence that a person gains after training for their walking pattern is different. It gives the patient the motivation that yes, I am functional, I can do my daily living activities, and that gives the independence. And for a stroke survivor, having that functional independence is very, very essential. Coming to climbing and descending training for both slopes and stairs. So, climbing and descending for slopes, we have a particular functional slope height where we train the patient with the railing support for climbing the slope as well as descending the slope. Slowly and gradually, we will decrease the support that we give as physiotherapists, and we are aiming that the patient be such functional independent that they can climb and descend the slopes with their railing support and be more independent. Coming to training for ascending and descending stairs at a varying height. So first we will start with a low step height, progressing to a higher step height or a generalized step height that we have for our stairs. And training and motor relearning for this thing will also help them to be more functionally independent. Now, coming to neurorehabilitation with occupational therapy. So, occupational therapy is basically an art, a science where the therapist work for the afflicted individual to reach to a level where they feel normalcy, they can do their daily tasks, and so they can undergo rehabilitation. It activates the coordination between the newly injected cells and the body. It normalizes the post cell therapy routine, the body movements, and the activities of daily living. It basically focuses on activities of daily living training like grooming activities with adaptive uses devices like adaptive combs, fine motor activities like buttoning the shirt, buttoning the pants, tying the shoelaces, again focusing on the motor relearning. Coming to toileting activities where they are shown how they can use compensatory approaches, use adaptive devices to be functionally independent and to be toilet trained. They treat the physical symptoms, the partial or complete paralysis, the rigidity, the grip, the movement, and the function that arise out of the neurological problems. They also treat the emotional symptoms like mood swings, outbursts, experience depression, delusions arising out of the neurological problems. They also streamline activities related to the cognitive abilities. So, post stroke, there is a lot of cognition impairment also seen in a lot of people. So, OT helps with the cognitive abilities, also with the perceptual disorders, the memory, the decision making skills, or controlled by our brain. And finally, they gauge the affected individual to participate and actively participate in society. They are undergoing this treatment so that they are not left behind in any aspect of their life. Functional independence also means actively participating in the society. Hence, occupational therapy helps with that. Here are some images showing toilet training activities, uh, pouring a glass of water, writing abilities, and ball catching, basically to improve the sitting balance. So the published data of Neurogen BSI, our results, also show that patients who have underwent cell therapy followed by an extensive tailor-made multidisciplinary neurorehabilitation, out of all these patients, there were improvements seen in the ambulation, that is a walking pattern, improvements seen in hand function, improvements seen in standing balance, improvements in walking balance, and improvements in the FIM scores, that is the functional independence measure, a scale which assesses the measure of how functionally independent a person is, how much amount of assistance the person requires while carrying out activities of daily living, eating, bathing, grooming, self-care activities, hygiene, walking, climbing stairs, etc. So, this graph clearly shows that post stem cell therapy and a multidisciplinary neuro rehab, there is improvement seen. Coming to neurorehabilitation with aquatic therapy, the main aim of aquatic therapy is to provide patients with better movement solutions to complement the land-based rehabilitation. The land-based rehabilitation, as in physiotherapy or occupational therapy, aquatic therapy helps in complementing these activities, and they also assist in the moreover of functional recovery. Aquatic therapy improves the muscle strength, voluntary control, sitting, hand function, standing, and walking balance. It increases the cardiac endurance of a person, the breathing capacity, the concentration, the attention span, the body awareness that a person needs, as in where is my hand moving, how far or how what is the amount of force that I can apply. That bodily awareness is very necessary. A greater degree of freedom of movement with various movements, be it lower limb or be it upper limbs, that are not possible on land. So as we all know, when we are in the water, we feel our body weight less, and hence this allows us a greater degree of freedom of movements. Aquatic therapy uses all the hydrodynamic principles of water to reduce spastic dystonia. What is spasticity? Spasticity is a very common impairment seen in post-stroke patients. Basically, there is abnormal increase in the tone of the muscles, and hence this can be treated very well with aquatic therapy. Pain during stretching exercises and to restore the bodily functions and the structure. So, these are some exercises that are done in aquatic therapy for trunk, for fine hand function, fine motor skills, the strengthening exercises with the use of dumbbells. All of these help in achieving functional independence. Now coming to neurorehabilitation with speech therapy. So post-stroke, a lot of patients have impairments related to language, speech or swallowing that may again depend on the area of brain being affected. Hence, oromotor exercises, treatment for swallowing problems, treatment for articulation of the speech and coordination of the mouth to produce sounds is very important. Our specialized speech therapist provide with continuous and intensive speech therapy after the stem cell for improvements to be seen post stem cell therapy in speech and language. Thus, early intervention needs to be given a lot of importance after the stem cell therapy. Coming to psychological intervention, there are a lot of cognitive, behavioral, and adaptive changes that happen post stroke. All these functional impairments has a very different effect on the person himself, and hence A psychological intervention in this period of time is very necessary for improving the cognition, that is the understanding of a person, cognitive rehabilitation. There are group therapy sessions that are arranged wherein the physiotherapist, occupational therapist, psychologist, speech therapist all give a group therapy session wherein other patients of stroke exercise together for a day, and this gives them motivation, the confidence that they are not alone in this, and hence there is hope for all of us. And such motivational workshops also help us to be motivated to aim for our functional independence and not lose hope. Counseling sessions with family and relatives are done to explain about the expected effects of the stroke, the prognosis, that is the progression, or how well if we treat them, how early we treat them, what are the chances of recovery, and the goal setting that are individualized according to the extent of the patient's impairments and his existing conditions. So, all of this is basically to motivate the family, relatives, and the person himself that this is not the end, this is just the beginning, and never let stroke decide your life. Diet counseling also helps a lot in early recovery from the diseases. Why? It increases the immunity that our body needs to repair or regenerate new cells, or post stem cell therapy to regenerate the new cells. Thus, a consultation from a qualified dietitian is important, as the right food prescribed according to the specific condition will help a patient recover from the health condition very fast. And hence, a nutritious, balanced diet given by a qualified dietitian is very necessary, and it should be implemented in our day-to-day practices. Coming to hyperbaric oxygen therapy. What is HBOT? It represents a possible therapy for acute ischemic stroke. So basically, we are giving oxygen in the form of inhalation, and this will increase the oxygen delivery. It will decrease the cerebral edema. The oxygenation in the brain increases. Hence, when the brain is deprived of oxygen due to the interruption of the stroke, it will enhance the cells that we have administered to increase the oxygenation in the brain, and hence will activate these stem cells and will, help in the repair and the regenerative abilities of the cell to be faster, and it will reduce the residual functional impairments. And HBOT has been shown in animal models for both focal and global ischemia, as in a part of brain that has been affected from the blood flow, or a global part of the brain being interrupted by a blood flow, to decrease the brain infarction, that is the affected area, the cells being dead, and it improves the outcome. So basically, oxygenation is very necessary for the brain. Coming to the integrative therapy, that is the ozone therapy. Research studies suggest that it increases blood flow and thereby improves again the oxygenation to the brain. So studies that show post-stroke recovery can benefit from this, and it can be hence used as an adjunctive treatment to the stem cell therapy. It shows better outcomes and better functional improvements in the brain. Researchers also show that patients with ischemia of common carotid artery or posterior cerebral artery, this is a bit technical. So when the arteries that are common carotid or posterior cerebral artery are being affected, have shown better outcomes with ozone therapy. So the importance of the holistic approach. Stem cell therapy, along with all these other integrative therapy, is very essential for better functional outcomes. And achieving the functional independence that we aim to have with all the rehabilitative approaches for better post-stroke recovery. Maintenance of these therapies at home with supervised therapists is also very crucial because it helps to maintain and improve the functional independence with a daily routine, a daily set routine of exercises and rehabilitation with the right frequency. That is the amount of exercises that we have to do each and every day as a part of our routine, and with sufficient rest breaks, because exertion will not help anyone. Sufficient rest breaks and the right frequency of exercises in maintaining all of these benefits post stem cell and post neuro rehabilitation is very, very essential for our functional independence. Hence, whatever we do, we have to set a particular routine for ourselves because it is very important. It is very important to achieve a functional independence, to train the brain in a particular way. And as the Kate Allett, a very famous stroke survivor, that she had survived from a locked in syndrome, very famously said, start thinking of wellness and not illness. So focus on what is important for you, focus on your wellness, and don't focus what you're suffering right now. Because when we try to focus on the solution, that we have many as a holistic approach, we get and gain our functional independence and we maintain that properly. Thank you.